Welcome to any community. What do you mean by prognosis? What is the application of prognosis? And what do you mean by the case scenario or clinical scenario? These are the questions that will be answered in this particular video. When you know the term prognosis refers to the knowing the future event. Knowledge, the gnosis refers to the knowledge. The term prognosis refers to predicting the possible outcome in future days or predicting the possible physiological events or pathological events that are going to take place. Suppose if the person is exposed to any particular etiological factor, that is considered to be prognosis. And clinical scenario, as such, that is what we can say the real life case experiences. When you think about the prognosis, suppose if the person is exposed to a dust, this particular dust may be exposed to mouth or nose or the eyes, etc. In that particular situation, the person may have the the cough, etc. In cases of exposure of dust through the mouth as such, wherein exposure through the nose, the person may develop the sneezing, running nose, etc. The exposure to eyes may lead to itching around the eyes, etc. That may be happening. Whenever you think about the next event, that is consumption of the curds as such, this may lead to the excessive secretions that may happen in the alimentary canal. Plus, there may be a possibility of excessive secretions that may happen in the uh, oral cavity also, or otherwise. The washing the clothes, exposure to the etiological factor will be there to the hands, and the uh, person may have the itching around the palm, etc. that may be present, or preparing the pickles as such. So wherein the one of the main thing that is red chili may be used in preparing the pickles. Of course, the person may have the sneezing, etc. And when you think about the clinical scenario, the real life experiences, that may be the setting in case of the hotel setting, where the person may have the indigestion, etc., diarrhea or vomiting, etc., that may be there because of the incompatibility with food substances as such in the travel, wherein the person may have the the suppressing the defecation urge, etc. In the vegetable market, wherein the person may develop sneezing, etc., or in the classroom setting, wherein the person may have the uh, the somewhat the mental stress as such we may able to predict it, or in the home setting, wherein depending upon the nature of the etiological factor, the person may have the clinical presentations as such. So this is what is considered to be the clinical scenario. So based on this particular background, so let us have the discussion of a given case. 38-year-old female patient presented to you with a history of chest pain since 10 days. So when you think about it, what might be the possible system afflicted in this particular situation? So when you think about the most probable descriptions, that is the systems that may afflicted, could be respiratory system or cardiovascular system or alimentary canal as such, or musculoskeletal system or nervous system. These are the possible systems that may be afflicted if there is chest pain. But when you think about the image is showing the specific location in the uh, center of the chest as such. Probably here the respiratory system that will be ruled out, because the respiratory system disease, the person may have pain on the either sides of the chest, wherein the centralized chest pain that is mainly observed in cases of the person who may be suffering from either cardiac disease or alimentary canal disease. So when you think about the ruling out alimentary canal disease, the person will be having the relation with the food intake, which may have an impact on the aggravation of the pain, chest pain as such, so which is confirming the alimentary canal as such. Whereas this particular clinical presentation that is specifically observed retrosternally, here it may be cardiac cause as such. As far as ruling out the musculoskeletal discomfort, wherein the worsening of the pain may be there on change of posture as such, maybe recommend posture to sitting posture or sitting posture to recommend posture, etc. That is considered to be worsening the pain, which is indicative of musculoskeletal dysfunction. And neurological dysfunction that can be ruled out because of the absence of the pain in the dermatome level. So like that, so that will be ruling out the nervous system dysfunction as such. In this way, the given case scenario, the confirmation of cardiovascular disease will be considered, ruling out other four systemic diseases as such. And when you think about the Srotas afflicted, what might be the Srotas afflicted in this particular situation? Probably here it could be a Pranavaha Srotas affliction may be predicted, wherein the Mamsabaha Srotas may be ruled out, or otherwise the Medovaha Srotas affliction may be ruled out, or Asthivaha or Majjavaha Srotas affliction may be ruled out in this particular situation. Plus Annavaha Sroto Vikara may also be ruled out, depending upon the nature of the clinical presentation. As far as dosha vitiation is concerned, here it could be Vata dosha vitiation can be considered. Some of the additional informations regarding the presenting complaint. The person is having the chest pain, which is getting worsened on performing the exercise for up to 20 minutes. This is again confirmatory of a cardiac disease itself. The person or lady is a Pitta Prakriti lady based on the physical parameters, such as the premature graying of the hair, etc., that were being observed. So, that is indicative of Pitta Prakriti as such. Then, development of the pain when she starts doing the exercise, heaviness of the chest and aggravated by exercise and relieved by rest. Again, these are indicative of the cardiac dysfunction as such. Associated profuse sweating in the forehead. Again, this is indicative of autonomic nervous stimulation, the two sympathetic nervous stimulation. Plus, she had the previous history of a pain in the right knee joint with the swelling for more than 5 years. So this is again an pre-existing illness before this particular clinical presentation. She had again a previous history of atopic dermatitis for more than 3 years. So these are the possible two images. Of course, these are the imaginary case scenario. So when you think about these as such, what particular prognosis we are going to think about? So based on the given data, we may say that what might be the possible dosha afflicted. Here that is Vata dosha vitiation can be predicted based on the pain which is worsening on exercise. So that is Vata dosha vitiation. Vata dosha vitiation can be predicted because of pain present in the right knee joint. Kapha dosha association is being predicted because of the swelling present in the right knee joint. Plus, Vata dosha vitiation is being predicted because of the dryness of the skin is being observed in the right foreleg region. So, when you think about the Bhashya Hetu, so here probably it may be the Vyayama. So, that is considered to be worsening situation. That is, that too, it could be a Vyanjaka Hetu that can be considered, wherein there may be a possibility of Chalaguna Vriddhi, Sukshma Guna Vriddhi, Laghu Guna Vriddhi may be observed. Because of that, we are going to say there may be a possibility of Bhashya Hetu, that is Vyayama as such. Whereas the discomfort in relation to right knee joint and the twak is not being considered in this particular situation. As far as Srotas afflicted is concerned, Pranavaha Srotas is being predicted, Rasavaha Srotas, that too, Hridaya and Twak as such that we are going to consider in this particular situation, whereas Astivaha and Majjavaha Srodhas affliction is being considered because of the presence of affliction of the right knee joint. And when you think about the order of the clinical presentation, initially the lady had knee joint pain, the later the lady had the right, so the skin of the right knee, foreleg region was being observed. Later, the lady had the chest pain presentation. When you think about it, the order of Srotas affliction could be Astivaha Srotas and Majjavaha Srotas, followed by the Rasavaha Srotas, wherein we are going to say the Tvak affliction may be observed also, plus Pranavaha Srotas affliction we may say because of the presence of the, what do you say, that the chest pain as such, wherein we may suspect the affliction of a Hridaya. As far as Srutadishti type is concerned, in this, Sangha and Vimarga Kamana can be predicted in all these four Srutadishtis as such. As far as Roga Marga afflicted here could be Madhyama Roga Marga and Bahya Roga Marga. So now, what is the utility of knowing this particular knowledge as such? And when you think about the given case scenario, we may suspect the Vata and Kapha dosha prakopa. In that particular situation, depending upon the dominance of the dosha, Vata dosha, we have to plan Vatasya upakramaha snehaha svedaha samshodhanam budu. Swadvam lalavanshmani bhujjanyabhyanga Veshtanam trasanam seko madhyam paishtika gaudikam. Snigdhoshna basteyo bastiniyama sukhashilata. Dipane pachani siddha snehashtanekayoneha. Visheshan medyabhishita rasatailan vasanam. And when you think about the Kapha dosha prakopa, we have to plan Kapha dosha hara chikitsa, that is the श्लेष्णो विधिनायुक्तं तीक्ष्णं वमनरेचनम् अन्नं वृक्षापतीक्ष्णोष्णं कटुतिक्तकषायकं दीर्घकालस्थितं मध्यं रतिप्रीतिः प्रजागरः अनेकरूपव्यायामश्चिन्ता रूक्षं विमर्दनं विशेषाद्वमनं यूषः क्षुद्रं मेदोघ्नमौषधं धूमोपवासा गण्डूषा निस्सुखत्वं सुखाय च. So like that, depending upon the dominance of the clinical, that is the lakshana, depending upon the dominance of the avayava afflicted, we have to plan either Vata Prakopaka Hara Chikitsa or Kapha Dosha Prakopaka Chikitsa. That is, Kapha Shamaka Chikitsa has to be done or Vata Shamaka Chikitsa has to be planned. And next aspect, the Nidana Parivarjana of Vata and Kapha Dosha Prakopa, that has to be planned. When you think about it, so we have to plan these Prakopaka, whatever may be the Nidana, that is Vata Prakopaka Nidana that is being explained. Yayamat, Apatarpanat, Prapatanat, Bhangat, Kshayat, Jagarat, Veganam Chavidharanat, Atishucha, Shaitya, Datitrasata, Rukshakrupa, Kashaitik, the Kutukairi, Prakopam Rajet, Ayurvari Dharagame, Paranite Chanya Paranya Puja. This has to be avoided depending upon the presence of these Nidana observations in the patient. Whereas Kapha-dosha prakopaka nidana, that is the Guru Madhura Rasati Digda Dugdhekshu Bhakshidra Vadadi Dinanidra Upasarpish Prapuraihi Tuhina Patana Kale Shleshmana Samprakopa Prabhoti Divasadau Muktamatre Vasante. So these are the nidana that has to be identified, that has to be avoided as such. As far as the Srota Dushti Chikitsa are concerned, we have to plan Astivaha and Majjavaha Srota Dushti Chikitsa has to be observed, and the Rasavaha Srota Dushti Chikitsa as well as Pranavaha Srota Dushti Chikitsa has to be planned in this particular situation. Whereas the Roga Marga affliction as such, so here the first and foremost two types of the treatment are planning has to be done. One, that is Sthanika Dosha Chikitsa. As the person is having the right knee joint affliction as well as the right skin of the foreleg is concerned, so we have to plan the Sthanika Chikitsa in relation to the right knee joint as well as the right skin, that is the skin of the right foreleg as if that has to be planned. Maybe the Janubasti etc. or maybe the Sthanika Rakta Mokshana Chikitsa can be planned. Whereas the person who is having the chest pain etc., so here we have to plan the Sthanika Chikitsa, that is Shamana Chikitsa has to be planned. Whereas if the person is having the virulence of the pathogens are much more stronger, then in that particular situation, we have to make this particular pathogen that should be moved from the either right knee joint or in the right skin into the alimentary canal. From there, it has to be eliminated either through Vamana or Virechana or Basti as such. In this particular situation, as the person is having the Vata dosha dominance, here we have to plan the Basti Chikitsa as such. As far as the understanding of Roga Marga and its the clinical presentation. So, the particular patient had the chest pain. The lady had the right knee joint affliction. The lady also had the right skin of the foreleg affliction may be seen. So, whenever we think about it, the pathogens which are being present in the intravascular compartment, they are moving all over the body itself. So, to know about it, we have to know about the concept of Starling forces and sludging of the blood. Whenever, if these pathogens are moving all over the intravascular compartment, depending upon the increased activity, there may be the movement of the pathogens, they are moving to take place in those areas where there is increased vascularity is present. So here, the lady had the chest pain. At that particular time period, the pathogens, they are moving from the intravascular compartment to the blood vessels wherein the blood supply to the chest may be occurring. And the lady had also the right knee joint pain. In that particular situation, so these pathogens, they are moving from the intravascular compartment to the blood vessels which are supplying the right knee joint. The lady also had the right skin of the foreleg affliction. In that particular situation, the pathogens, they are moving from the intravascular compartment, that is the capillaries, to the skin of the foreleg as such. So that means whenever if these pathogens are moving, so that means here the pathogens are present in the chest or right knee joint or right foreleg. So in that particular situation, what is the right treatment plan that can be planned? That is, that may be a possibility of the pathogens, they are present in the intracellular compartment of the right skin, that has to be brought in the interstitial compartment of the skin, then that has to be brought into the intravascular compartment, then that has to be brought into the alimentary canal, then that has to be eliminated here. If the person is having the pathogens that are present in the right knee joint, that is in the from the intracellular compartment of the right knee, that has to be brought into the interstitial compartment of the right knee, that has to be brought into the intravascular compartment. I say from that, that has to be eliminated in the alimentary canal. Similarly, in case of the chest as such, from the intracellular compartment of the chest, it has to be brought into the interstitial compartment, from there to the intravascular compartment, from there to the alimentary canal, from there it will be eliminated through the either Vamana, Virechana or Basti. So when you think about this, the clinical presentation, the lady had more than one clinical presentation. That's why it takes more amount of time in this particular situation. So the call to action from this particular video is, we have to identify the Lakshana first. Then we have to try to connect with the Nidana and Lakshana in terms of the dosha vitiation, in terms of the dusha affliction, in terms of the Srotas involvement, in terms of the Srotodishti happening inside the body, that has to be calculated based on the nature of a chronology of the symptoms as such. Then collect the information, additional information as much as possible, and try to connect them with the Lakshana and other factors, and make the prognosis based on the above said parameters, and try to make the rationality for your diagnosis as well as the management plan, plus even prognosis also, so that you can make the best communication with yourself as well as the communication with the Ayurveda fraternity and Ayurveda health seekers can be done with much ease. Dear community, that's all for today. What are the mere key takeaways from this discussion? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners and spread this particular video the maximum Nidana learners so that we can make a huge movement out of this particular small message.